I thank Ms. Feza because she has already given the psychopharmacological basis, what I'm going to be explaining, telling. And I will be talking about antipsychotic treatment in schizophrenia, how successful we are, whether we are treating. The critical question is whether we are harming the patients, because there could be a kind of point like this. And we have Kazım with us from Hacettepe University, and with him, we have carried out a study at the beginning of 2000. It is then follow-up of schizophrenia patients in Turkey, and in this study we use BPRS, and this is the symptoms of positive symptoms, and the yellow ones are negative, and the red ones are depressive symptoms. And as you would pay attention in BPRS, within 1 year, there is a decrease of 1 to 2 points. And actually, in this study, 382 patients were included, and encompassing all of Turkey. This is a map of Turkey. And as a result of 1 year, half of the patients were included in the treatment, and half of them were excluded. And actually, if we consider that the ones who are not in treatment, they were worsened, we can also think that this is not even 1 or 2 points. So within 1 year, in 2000, we couldn't treat this schizophrenia, especially from the perspective of symptoms. And we could not carry out the third year because we could not access the patients. This is one of the main problems in Turkey, that we cannot follow up, but we need these certainly. And after 1 year, the patients that we treat, after 5 years, 10 years, what is their condition? We cannot find this. And related to follow-up studies, I will present 4 studies. One of them is from the CIS. This is a 5 year follow-up, and here there is the symptom remission. And also, we see that the remission of the, or the improvement of the social functioning, and also there is the full recovery criteria. The symptoms improved, and also psychosocially, they have. They also looked in the patients who could get married and also could work. So as a result of 5 years in the USA, we see that recovery is about this percentage. And this is from India. There is 10-year follow-up, and clinical global functioning is evaluated. It's 30%. There's a myth that in the half developed countries the prognosis is better, and we see that 40% in India, and after 10 years they seem to be working. They are working in a certain workplace. And from the UK, it is about 50 to 25 years of follow-up, and the result is there is an 16% of good result. But there's a important point here, that in some patients there is an effect of late recovery of in the young patients, and I will be talking about what it means. And Ms. Feza mentioned that the existing or current drugs are blocking the dopamine. So there are proofs for this as well, because many of the researchers take us to dopamine. For example, the schizophrenia patients, during their acute time, there are imaging spectrum or PETs show that the dopamine receptors are very active, and these in patients in their brain blood barriers and liquids, the dopamine are really high, and also the cocaine and the they cause psychosis. So for that reason, so dopamine and psychosis relation is very clear, explicit. And so what we ask is that whether we have the same relation in all of these schizophrenia patients. And apart from the dopamine, the different mechanisms have got roles, and one of them is pimavanserin. And at the end of the pandemic, it was approved by the FDA. It's still used in USA, but it's $800 for a box. It's very expensive. As mentioned by Ms. Feza, they act on serotonergic receptors, and there is no schizophrenic studies for the time being, and there are phase 2, phase 3 studies ongoing. And we know very well is that a psychotic patient we face with the antipsychotic drugs, we make recover out of 1 patient, and a patient who cannot recover with 2 drugs. With the third one, they can recover, but this rate would be about 7%. So clozapine, when we use clozapine, the patients who do not recover as 3 patients, only 1 can recover. So for that reason, we have to make the evaluation accordingly. And the patient with psychosis in his brain, dopaminergic system would not be in the would be wouldn't be would be in good condition. But if the patient with a normal this system in the long term, how these drugs would be affected. This is a study related to clozapine, and glutamatergic system is one of the pathways that clozapine acts. And here, as the recovery increases in the brain, in the glutamatergic system, there is a lessening, and statistically it is found to be significant. And in many acute patients in the researchers carried out, the schizophrenia patients, for example, when there's a comparison made with the control patients, the glutamatergic system is very active, and it is very striking study here, especially in acute patient. Glutamatergic system and dopaminergic system are compared to each other, and here the patients responding and non-responding, the glutamatergic system levels are looked in. For example, within 6 weeks, we see that the glutamatergic system levels in the responders and non-responders compared to the healthy controls, we see that this is quite high. So actually, psychosis patients, we see that the glutamatergic system is not functioning good. So with a blocking agent, we're just recovering these patients. So we see that the patients, the effect of prolonging and so I don't know whether longitudinal study is. I don't know whether we can do this. And we know that there are many studies, certain dopamine antagonist drugs, they are protecting the brain. And for example, Nasala group has gotten evaluation year, assessment year. However, these studies, both the animal or the human researchers are just small or very short time studies, just for 3 months, for example. However, for years, the ones who are using these drugs, there isn't any study what's going on in the brains of these people using these drugs for a long period of time. So in the patients using such agents, for example, you see the particle volume, so it is decreasing, and there's a gray matter decreases, but white matter increases, and it's a 13 years of follow-up. The volumes of the schizophrenia patients decrease, volume of the brain decreases, and the exposure to the drugs actually increases significantly. And later the follow-up period, there is an UK study. It's about the late recovery, and there's an interesting point, especially within 2 years, especially usage of the proper use of the drug, it actually decreases the flarings, And this is, as you would see, after 2 years, there's a change. The schizophrenia patients are separated within two groups. In one group, there's a recovery, and these patients recovering, they have less anxiety level, and cognitive activities are better. And we do not know very well, but for the schizophrenia patients, a group of patients within this, it's about 35 patients, there is a kind of recovery by itself. And these actually are excluded because they recover, but the other ones can just stop using the drugs just to have had the recovery already. But the problem is that in the first attack, we use the drugs blocking the dopamine, but neurotoxicity is to be studied, and the human and as well as animal studies should be carried out, and whether there's a difference used in usage of the days. And we need also new drugs. And if we're talking about recovery in schizophrenia, it is not significant to have this recovery of the recovery of the symptoms, but the cognitive functions and negative symptoms, as well as enabling the patients living in a social independent and social functional capacities are directly interpreted and predicted. And later to this, Ms. Faiza also mentioned about the drugs that have been already used and being used, and this is actually a general review. And here on the left side, the dopamine receptors, through dopamine receptors, these are the drugs introduced into the market, as well as the rates of the patients using these drugs. On the right side, the fields, the target receptors, and also the rate of the patients. But in this field, yet there is no drug introduced to the market in this field. And what has been done so far, and so far we do not have any drug in the market. And of course, the beginning of this story is that it is Lilly's drug. It acts through glutamatergic system, especially hypoglutamatergic dysfunction decreasing, and cognitive, it is related with the cognitive functions directly, and glutamatergic system is increased if it is in the acute phase. And this study, actually, Bliskinon is a psychiatrist, especially this is a person who really really made this and dedicated himself to this study. So they did not apply to FDA, and this was withdrawn. And then when we look at this, the most important thing is placebo responses, especially in the recent years. Schizophrenia, one of the problematic fields of the schizophrenia, the placebo responses. If the responses are high in placebo responses, then the efficacy of the drug that you would like to devote, there would be a problem. And the second one is bitopertin, and as mentioned by bitopertin. And here is the first stage. We see that daylight. There are negative symptoms are affected, but the second phase found to be similar to the placebo, and Roche withdrew the drug. And here we see the high placebo responses were achieved. And just recently, and there is another molecule, roluperidone, and this is 5-H2A and sigma-2 receptor antagonist. And Michael Davison is the schizophrenic researcher, and he has got a hypothesis. If schizophrenic patient is using an drug blocking the dopamine, and you cannot develop a drug which would recover the cognitive functions as well as other functions, because because with a disruption in this system, it would not help. So for that reason, roluperidone studies were carried out in this, and there was also the debate regarding whether this was right or not. As a result, there were two phase 3 studies, and the first one there was a significant efficacy found, and the last year the second one was resulted and FDA found the results to be insufficient, and phase 2, phase 3 studies are to be carried out once again. The decision was this, and clinically the method was not found to be appropriate. And Ms. Feza mentioned very well the promising drugs are the ones which are affecting through muscarinic system, and Karuna pharmaceutical company has got studies, and there are two phase 2 studies have been accomplished currently. For example, here we see that PANSS total score is significant, and positive symptoms and negative symptoms are also significant. Recovery are achieved. And as mentioned by Ms. Feza, we see that the trospium, in order to recover the side effects. So FDA has already approved it, and the application to FDA has been done, and the result is expected, and probably this will be approved by the FDA. But in Turkey, whether will be able to use this in Turkey or not. And finally, I would like to we talked about eclopertin. Where it is studies, it's about the cognitive functions. There is a positive study ongoing, and this is soon to be accomplished and resulted. And Turkey is within this. If the phase 3 would be results would be finalized, and probably we will have the opportunity to use this. And as a conclusion, schizophrenia, the treatment success is low. The dopamine blockers are successful in the first acute attacks in patients, and these patients just blocking the dopamine, perhaps we may be harming the patients, and perhaps in future they may the upcoming generation could criticize us just looking in the back to 2000, and in the rat and as well as human studies. The dopaminergic system usage drugs are used, and especially negative symptoms, we need this. But in drug researchers, there are problems, especially there are 5 different drugs were finalized, resulted in negative result, and the most important reason for this is the high placebo responses. So in 2000, the placebo responses were less than 5%, but in recent times, it's about 5 to 20%. Thank you very much.